So today, we're going to dig into a document that's so much more than just a dry medical text. Think of it as a blueprint, a detailed, life-saving plan designed to make childbirth one of the most incredible but also vulnerable moments in life as safe as it can possibly be. Let's see how it works.
Wow. Right from the get-go, this document is not messing around. This line from the preface, it just hits you. It frames the problem with such brutal honesty, not as some distant statistic, but as a national failure. It's a powerful way of saying the status quo is unacceptable and we have to do something about it.
And here's the answer. This guideline isn't just a list of suggestions. No, it's a systematic plan, a strategy built from the ground up to bring order to what can be a chaotic and dangerous situation. It's designed to erase that blotch, one safe delivery at a time.
Now, to build a solution that actually works, the people who put this together first had to figure out what was really going wrong. And what they found was that the path to a safe birth was often blocked by three specific points of failure. They gave them a name: the 3 delays.
And here they are. This is basically the road-mapped disaster. First, there's the delay in even deciding to get help. Second, there's the delay in actually getting to a hospital. And third, and this one is so important, is the delay in getting the right care, even when you're already there. Every single protocol we're about to look at is a weapon designed to break a link in this deadly chain.
So, how do you fight that very first delay? The one where someone hesitates to seek care? Well, you make healthcare a predictable routine, not a last-minute emergency. The plan kicks off by laying out a super clear, non-negotiable timeline for checkups all through the pregnancy.
You can see how this schedule builds a rhythm of care. It starts early with registration, then it moves to monthly check-ins. And notice this, as delivery gets closer, the visits get more frequent, first every 2 weeks, then weekly. This setup is really smart because it does 2 things at once. It provides constant medical oversight, and it normalizes contact with the healthcare system, making it easier for an expecting mother to speak up when something just doesn't feel right. And these visits, they're not just a quick chat. They are vital data-gathering missions. Healthcare workers are running a whole series of tests that act like an early warning system. They're checking for things like anemia, blood type compatibility, gestational diabetes, and other red flags. Think of each test as a little checkpoint designed to spot a potential problem long before it can turn into a full-blown crisis.
So, what happens when that early warning system actually goes off? Well, this right here is where this whole plan really proves its worth. It gives health workers incredibly clear, data-driven playbooks for handling some of the most life-threatening complications. Let's take a look at a big one: preeclampsia.
To put it simply, preeclampsia is dangerously high blood pressure that happens during pregnancy. And if it's not managed properly, it can escalate fast. We're talking seizures, organ failure, and it can be fatal for both the mother and the baby. It's often a silent threat, which is exactly why those regular checkups are so critical.
And here is how the guideline completely eliminates that third delay, the delay in getting the right care. It takes away all the guesswork. It uses hard numbers. You see this table? If a patient's blood pressure hits these levels or their lab results cross these specific thresholds, boom, it triggers an immediate, aggressive response. There's no room for interpretation. The data makes the call.
And the action plan itself is crystal clear. Step 1 is all about defense. You give magnesium sulfate to protect the brain and prevent seizures. Step 2 is control. You use medication to get that dangerously high blood pressure back down to a safer range. But step 3, well, that's the ultimate solution. Deliver the baby, because ending the pregnancy is the only true cure for preeclampsia. It's a logical, decisive protocol that leaves zero room for error. Okay, so the plan doesn't just stop with prenatal care. It carries us right through to the moment of birth itself. And it has a clear protocol for one of the most feared complications of all: severe bleeding after delivery, which is known as postpartum hemorrhage, or PPH.
After a baby is born, the uterus, which is this incredibly powerful muscle, is supposed to clamp down hard. This action squeezes shut all the blood vessels where the placenta was. But sometimes it doesn't. And when that muscle fails to contract, you get what's called atonic PPH, and the result can be a catastrophic, terrifyingly fast loss of blood.
And this really gets to the core philosophy of this entire document. It's so simple, but so profound.
The goal isn't just to be a hero in a crisis. The goal is to set things up so the crisis never happens in the first place. This proactive mindset is a total game changer.
This protocol, called AMTSL, is just a beautiful example of a simple checklist that saves lives. It's 4 steps, and they're done for every single delivery. 1. Give a shot of oxytocin right after birth to give the uterus a helping hand to contract. 2. Wait to clamp the cord, which is better for the baby. 3. Use a very gentle technique to help deliver the placenta. And 4. Give the uterus a firm massage to make sure it stays tight and contracted. 4 simple steps that drastically reduce the risk of PPH.
So let's zoom back out for a second. We've seen the schedules, the data points, the emergency checklists, but how does it all fit together? How does all this actually solve that huge problem we started with, the 3 delays? This slide lays it all out perfectly. To fight the first delay, the guideline creates a predictable schedule that empowers mothers. To tackle the second, it makes giving birth in a health facility the default planned outcome. And it completely obliterates the third delay by giving every doctor and nurse a crystal clear evidence-based playbook. It ensures every single mother gets the same high standard of care, no matter who she is or where she gives birth. And that, right there, is the magic of this whole thing. The real power of this document isn't in any single procedure. It's in the system it creates. Standardization takes the chaos and panic of an emergency and turns it into a series of predictable, manageable steps. It makes safety the rule, not the exception. And so, that leaves us with this final thought. We often think that big problems require complicated, high-tech solutions. But this blueprint proves that sometimes the most powerful and revolutionary tool you can have to save a life is as simple and as profound as a checklist.